don't have it all together because we ain't got it all together. But that's okay. My name is Megan Thomas at Meg Scoop everywhere.
And I'm Marisa Johnson, and she is Marisa J. Make sure to follow Mommy Needs a Break podcast on all platforms at MNAB Podcast. And make sure to check out our Patreon, be a Patreon, support us at our website at mnabpodcast.com. You can join for $3 and you can get exclusive content, first dibs on giveaways. We have a lot of great giveaways in the next coming months. So make sure to check us out.
Absolutely. Now, this show is action-packed, as always. We're talking about buying a walker for your kid. We're talking about fat mommy feet. We're talking about gangrenous, stinky, funky, beautiful feet that support our bodies as we walk on them. But first, you see our guest. She got on a white coat. She's beautiful. She is a podiatrist. She is a highly trained foot and ankle surgeon in Orange County, California. Hampton University alum. Shout out to all the HBCUs. And she is one of the stars of TLC's My Feet Are Killing Me. Y'all give it up for Dr. Ebonie Vincent.
Hello. It's really great to be here.
First of all, Dr. Ebony, you are beautiful. Okay. Like
Thank
when I
you
watch
so much.
when I watch you on the show, I'm like, she's so pretty. Her skin is so flawless. Like, oh, I love it.
Well, thank you.
You're welcome. So I love your show. I'm so proud of you because you're on TLC. You have a show on TLC, which is one of my favorite channels on TV. And you are like one of the most sought out podiatrists and ankle surgeons, foot ankle surgeons in the US. And I'm so excited that you're with us today. So thank you for joining us.
So good to be here. I'm so excited you like the show.
I do. But you know what? Because I am Marisa she's like a lot of people. So she thinks feet are disgusting. Like, ew, I don't want to see nothing.
A lot of people do.
I think they're disgusting, but I love it. I love it. I love looking at psoriasis on people's feet, bunions, the little wood, nasty fungus toenails. I don't know why, but I love looking at that.
Well, there are worse things to see. So, yeah. Yes.
All right. So let's, before we get into that, I think, Marisa, you have some mommy tips?
Yeah, I have a mommy tip today. So I have a 3-year-old and an 8-month-old. I carry my 3-year-old with me everywhere. I think I carried her when I was pregnant until I gave birth. She was just always attached to my hip. And so with this one, it's pretty similar. She's a COVID baby. And my mom kept saying oh, get her a walker. And I'm like, what? She's not going to sit in that. She didn't like the bouncy thing. She didn't like a playpen. She didn't like anything. She just wants me to hold her. And so I went away for the weekend and I came back to all these pictures and my baby's rolling in this rocker. She's having a great time. She's hanging out with her older cousins, in this walker. And they're like, yeah, she was in there all day. And I'm like, how do I not eat? I don't eat some days. I don't I got to bring her to me in the bathroom. It's just me and her all day. And I've never thought to buy a walker. So I took that walker home with me and it's almost saved my life. This is probably amateur. People probably duh, buy a walker. But I'm on my second kid and I never knew to buy a walker. I don't even know. So my mommy tip is to buy a walker because it helped me help my child.
Your hands free now, I guess, huh?
Yes. I mean, she still is attached to me. Don't get me wrong, but there's moments all I have to do is give her a little snack, throw her in that walker, and I got a good 10 minutes of free time.
Ooh, yes.
Buy a walker. My tips are so amateur. Megan's are always detailed and thought out.
That's actually. I'm glad you said that because there's so many times, I know my pediatrician said, don't buy a walker just because there's a lot of parents who don't who don't, you and I are very on our children. We watch them all the time, but there's some parents who are very lax with watching their kids. So they just let them go on a walker. They don't watch them. And then there's a lot of injuries that happen. So my pediatrician was like, just don't buy one. Cause I don't know if you that parent or not. So as a result, we didn't get one, but we got the push kind. So we use that. But my son was up early. He was 6 months. He was trying to walk. So we were like, okay, get this. You can mow the lawn later in life. You can learn this skill. So get a walker. Question for you, Dr. Vincent, Dr. Ebony. Can you tell us when you see your pediatric patients, when it comes to their feet, what kind of shoes should they wear to help with the development of their feet?
So it depends on the child. I mean, most kids have a lot of flexibility with their feet, and it kind of depends on how they grow into them. Most times I'm seeing kids, around age 3 at the youngest. And a lot of times it's because their parents are concerned because they walk funny. That's pretty much literally what they said. My kid walks funny. And usually my response is, okay, well, what was the birth? Was there any birth defects, any clubfoot, anything that you're, genetically concerned about? Because to be honest with you, the way that the kids develop and grow, they can grow into having normal gait, normal feet. There's not much to do when they're that young. If a kid gets a little bit older, like say they're 6, 7, 8 years old, and they have like flat feet, like a flat foot deformity, you can kind of tell that they're walking oddly. I do have suggestions for inserts, like shoe inserts that you can put into their shoes that can actually help them grow correctly, because at that point they're still very moldable. So a lot of times I'm suggesting to parents, there's casts, there's inserts, there's other conservative measures that you can take before considering anything invasive for your kid. So
should babies wear shoes? Me and Megan had this whole conversation the other day about like hard shoes, like her friends.
Yeah, like I have a whole my southern friends are like old school, and they're like, oh, we need the hard bottom, those ugly white shoes that people have for the babies. And I'm like, no, get the soft sole. And they were like, no, hard bottom. So like, which one? I mean,
I don't think you really need a hard sole shoe for a baby that's not walking. I don't think that that's super necessary. Once your kid does start to stroll and ambulate, then of course, like they have like nice little baby shoes that you can wear that aren't necessarily specific, but they're not soft. They're a hard shoe that they can that can support their body weight.
Okay. So it's only when they're walking.
Yeah, like when they're newborns. Like I don't understand those little like wooden, those wooden shoes. I'm not quite sure what that does.
I know. Look, my son had on the socks with the shoes printed on them. I was like, there go your shoes. Yeah. Okay? Those are some shoes for months.
Yeah, they're very expensive too. I'm not a mom yet, but I always like look in shoes and I'm like, why are these baby shoes so expensive? They're not even walking on me.
Right. And they're not going to be able to wear them in like 2 months.
Right.
So let's talk about you being a podiatrist. Feet can be very gross. You know what I'm saying? Yes. They can be stinky and like they can be flaky. What made you go, I'm going to be a doctor and I'm going to be a doctor of podiatry?
Well, anybody that works in the medical field can tell you that it's not a glamorous or pretty field. Like you're dealing with sick people, like regardless of what body part you're dealing with, like it's not going to be pretty, So, when I was going through school at Hampton, I was majoring in biology and I was thinking, okay, well, I want to be a doctor, but what kind of doctor do I want to be? And I played volleyball at Hampton University too. So I was more so on that sports medicine mind track. So in order to be a sports medicine doctor, you're either looking at like physical medicine and rehab, or if you want to do that surgical component, you're looking at it like orthopedic surgery. So, when you learn more about professions and you do more shadowing, I shadowed a ton of doctors. When you look at the overall lifestyle and what you want to do as a profession, podiatry just seemed to fit me. It's pretty even keel when it comes to a 9 to 5. You can still do surgery and you can still have room to create a family if you'd like. So, and those are things that are super important to me. And without, knocking any other medical profession, but, orthopedics, they work a lot of time, like all the time. Yeah. So I didn't see that other life aspect happening for me, had I chosen that route, but podiatry seems to fit me very well.
Very cool. Now let's talk about some of these like cases, because when I watch My Feet Are Killing Me, some of these I'm just like, how did you touch that foot and not cringe? So what is like one of the craziest cases that you've had and that you were just like, I don't know if I want to do this.
Yeah. I mean, well, the growth factor is one thing. You can always see patients who have kind of neglected their feet. We see that on a daily basis as podiatrists. We're seeing like gangrenous wounds. We're seeing like sometimes really bad things that they won't probably show you on the television. Like I've seen maggots come out of people's feet before.
What?
Like, yes, it gets really, really intense in real life. They probably won't show that on TV, but
They
but
need to.
it does get more gross. So, on the show, I will say that the challenges on the show come from dealing with patients who've had long standing issues for like over 15, 20 years. And it's not a matter of let's do one surgery one time to have everything miraculously be okay. Some of these cases that I'm seeing coming up are, really making me scratch my head like, okay, so the first time we do surgery, we're going to do this. And the second time, we're going to consider this,
Right.
because it's a lot of healing your body needs to do when you have had such a long history of being sick or having an illness with your foot. So that's the only kind of head scratcher. As far as the growth factor, I mean, at this point, I don't know. I just have a really thick stomach.
What did you do when you saw the maggots?
Nothing. I just sort of, I was just like,
Sir,
it's always in the hospital setting. You try to not make the person get alarmed or feel bad, So like if I just was like, well, you have maggots in your foot, the person would probably like scream bloody murder and like I don't know what would happen. But
right.
I was just like, okay, you know what? I'm gonna clean out your wound. And then when cleaning out the wounds involves cleaning out the maggots, I just kind of softly let them know, well, you know what? There were actually maggots in your wound. But thankfully, those were actually cleaning up more things than they weren't doing as much harm as you might think. So it's okay.
Oh my God.
They're gone.
Look, you know what? Dr. Ebony's getting the Positivity Award for 2020. The fact that you could spin that and you made that so your bedside manner is amazing.
I'm not even trying to make anybody feel bad. It's you're already here. How bad could it be? So how much worse
that's
can
why
it get?
I can't be a doctor. I'd be like, you got maggots in your feet, sir.
It's always kind of traumatic the first time you see it, though. I'm not gonna lie. When I first saw it, I was just like, what did I just see? Like, what is that? But
Yeah.
your mind just kind of gets desensitized to more things as you kind of do more things in their career. So
Okay.
Dr. Ebony, so you mentioned that you were a graduate of Hampton. What are some of the challenges you faced as a Black doctor, female doctor in this field, especially coming from an HBCU?
Well, you definitely hit the nail on the head. There's definitely layered challenges.
Right.
With it.
Let me forget the female.
Right. So I don't know which one exactly provided more challenges, but I will start with, in general, podiatry is more heavily dominated by men, specifically white men. So it is a little bit intimidating when you're going into a field where you can't really see someone who looks like you and how they carry themselves in the field. So I'll say that thankfully later on in my career, I did have a few mentors who I was like, oh, okay, thank God, a woman, like,
Right.
This is how she does this. Is she still, has everything that she wants in her career and her life? Like this is doable. So that was definitely a challenge, oftentimes being the only woman in the room. For 2 out of the 3 years of my residency, I was the only female. And for 3 years, I was the only African-American person in my entire program. So, and then on top of that, I went to Des Moines University. So I was literally the only African-American graduating in my entire class. So I definitely have experiences and challenges, but I think the biggest challenge is just in your own head. You just have to figure out how to not have imposter syndrome, which is pretty hard to do if you can't see it. Oftentimes you wonder like, man, should I even be here? Like maybe this is not the right thing, but you pray about it, you move on from whatever failures you might have had, and then you just kind of do it all over again the next day. So that's pretty much how I kind of got through school, how I got through residency, how I got through, just trying to do this whole entire career, which it's unfortunate that you have to do these things pretty much alone as a female and a Black female and at that.
Yeah.
But it's fortunate in the sense that given the fact that this TV show has taken off, has you develop a layer of skin that you just you wouldn't have otherwise. You just have it because you're already getting it every single day and you're already nobody, and now you're somebody. You're gonna get it twice fold.
Yeah.
So
you're definitely in your calling, I would say, for sure. Like, and I'm glad you persevered through all of that tough, just being the only Black student, the only female, the only, coming from an HBCU.
I would say Hampton definitely helped with that, though. Like if I didn't have my HBCU experience, I would never have had the confidence to know that there were people like out there just like me in the same situation, doing more and better things in completely alone doing it. So it's definitely, I appreciate those 4 years of just like getting embraced with all of that, just uplifting, and so I credit, I guess, everything to my HBCU, but mostly just that layer of thick skin and that layer of you can do this, forget everything else, you got this,
Yes, and you got this because, girl, you done got this to a TV show. TLC's right. My feet are killing me. Were you ever scared to show your work on this show?
You know what? It happened so fast that I feel like I didn't really have the time to even think about it, to be afraid. I think that I'm proud of the work that I do on a daily basis, and I don't think that I would do anything different or better just for the TV show. So after it was filmed, then I was like, oh God, what what happened? Wonder what people are going to think of that. The first time I actually did think about it, it was just like, oh man. But I mean, I did what I did, It's already done. It's in God's hands now. That's kind of how I felt about it.
Yeah.
There's a holiday special coming up. How is this season different from the past seasons?
So I think this season is a little bit different because they're kind of getting to know the doctors better. You're going to see a bit of my family more, my parents, my brother, and a bunch more of my family members actually too on the Christmas special because they're really taking a deeper dive into the life of Dr. Ebony, which is cool. I hope. We're not judged by that either, but
Right, superstar.
Yeah. I think it's going to be fun. It's going to be festive, and it's going to hopefully you'll like it.
Yeah. So wait, on this season, my feet are killing. My feet are killing me. First steps. What's different compared to like last season?
Well, this First Step series is actually because of COVID. We were kind of, filming slowly the next season before COVID happened. And then elective surgery shut down and we weren't able to do anything. We weren't able to see patients in the office for a period of time. We were just basically having access to our patients via telemedicine. And in order to not have the balls like so pushed back because of COVID, it was important to at least establish a relationship with the patients that we were going to be doing surgery on. So essentially, First Steps is what it is. It's the first step of us meeting the patients, figuring out what their pathology is, what exactly hurts, and what needs to be addressed when we can address it. So now that things have lifted and we are doing, elective surgery, we are still, filming and things are kind of back to normal-ish.
So a little bit.
So you're so you're doing like virtual consultations with all of your patients, correct?
We are. Yeah, we're doing virtual consultations.
So like this. So they'd be like this. Can you
like
diagnose
like feet like
here's my bunion. Can you look at my bunion and tell me?
Oh yeah. It's pretty hilarious. Yeah. I mean the amount of acrobats people are doing and like putting the computers on the floor and legs above the heads. We're like, okay, well, I mean, at least there's nothing wrong with your legs.
Speaking of
Well,
which, I do
here's the
have to
thing.
ask you this quick question. So
Yeah.
I have had I remember being in the second grade and looking at my feet and going, my feet are so bony. But as I got older, I realized it's bunions. Are bunions
Wait,
hereditary?
what?
Yes.
I have bunions. My bunions are
You
I've
have a
had bunions
bunion.
forever. You said what?
Aw. Well, yes. I mean, bunions are largely hereditary, but they're made worse with, activity, shoe gear, all that kind of stuff. It depends on, if your mom, dad had bunions, your grandma. I tell everybody, look at your grandparents or your parents and see how they're managing with their bunions, because that's what you could most likely look forward to.
Oh Lord, I gotta wear those little
Oh
ugly
my
little
gosh.
nude patches on my bunions.
Really? I
That's
mean,
what
it
my
might.
grandpa wore.
Really? Oh gosh. Well, it might be worth it to look into getting it fixed. You're young, healthy, able to, recover from bunion surgery at this point. So, you don't have to wear the pads like grandpa if you don't want to.
Oh my gosh.
Oh my gosh, you know what?
Wait, is that
I might do that. I'm coming to you
is
though,
that
Dr.
covered by
Ebony.
insurance?
Yeah, I
Yes,
Are
mean,
these things covered?
it is.
Oh,
Insurance covers it.
interesting.
mm-hmm.
Okay, that's interesting. So this is a mommy show. So I do want to ask one question related to mom. So when we get pregnant, our feet tend to grow. They
Yes.
get swollen. They do all these crazy things. First, why is that? And then, do they ever shrink back? Because I was a good 8.5, 9 my whole life, and now I'm like a good 9, 9.5, and it's awful. Why
Right.
my shoes
Well,
don't fit?
well, there's a few things that happen with pregnancy. Most of the time, you do have a lot of swelling that can happen, like
Yeah.
your lower extremities just kind of blow up with fluid that they really can't push back. So, compression socks are a good method to kind of control that. A second thing that can definitely happen is your ligaments become loose, meaning the ligaments connect bone to bone. So if you have had the experience that your feet got bigger, it's probably, or a little less stable, it's because your ligaments become looser with pregnancy. And then if
Hmm.
you haven't had flat feet before, with the increased weight gain, the increased amount of fluid that you're retaining, you can imagine with all of that plus the ligament laxity, your feet can become
Right.
flatter. The bunions can become bigger. So yeah, I mean, pregnancy is definitely a labor of love. I haven't yet to
It is.
experience it.
Girl, you will.
Ooh,
Your
Dr.
feet. You'll
Ebony.
probably save your own feet.
So yeah, the amount of pregnant women coming to me with plantar fasciitis too also increases. That's like heel pain. That's mostly because
Yeah. Oh
the
yeah.
tissues on the bottom of your heel are very swollen, and that happens a lot too. Um, will it go back to normal after pregnancy? Was the second part of your question? And yes, most of the time it does. It just takes a little bit.
So wait, so your feet can shrink back to the size it was before?
Not shrink, just the ligament laxity will kind of get stronger, and then the edema will
Relax.
go away, so they'll get better. They won't be as they are when you're pregnant.
So sorry, Marisa, you just gonna stay a big-footed heifer. Sorry, boo. That's what Dr. Ebony was basically trying to say in her beautiful bedside manner.
Right.
You got big feet, girl. That's okay. My size 10 stayed size 10. So I was like, yes, Lord, because there ain't nothing else after this in the shoe store.
Right. You
Okay.
probably buy a bunch of shoes and stuff like that and keep buying them, I guess.
So yes, so Dr. Ebony, before we let you go, what's next for you personally, professionally? Like what's going on with the show? What can we look forward to?
So essentially, we're gonna have more seasons of the show. I'm still gonna be practicing in Orange County, so if anybody needs their footwork done, just let me know.
Right down the
And
street.
yeah, and we'll see. We'll go from there. It's one of those things where the world is my oyster. I'm open to any
Yes.
possibilities that happen and open to them. So I'm thankful for the show, and I'm happy it's doing really well. So.
Yay! Okay, now look,
Now I
I'm
have
definitely,
something other to watch than 90 Day Fiance.
which is our show. We love that too. We love our TLC shows. But for sure, if you make sure you guys check out this new season of TLC's My Feet Are Killing Me, Thursdays, 10:30, 9:30 Central. I'll definitely be on there, and I'm hoping to be on the show as a patient. My bunions don't hurt, but I would like for them to get fixed. Okay,
I hear
doctor.
All
Yes.
right.
Well, this is our last segment of the show. What do we have, Marisa?
Oh yeah, you're staying on. This segment is called I'm Fine. It's our segment where we like to leave you with a little inspiration to get you through your week. And so today I have there's no better way to energize your body, mind, and spirit than by taking care of yourself. And that's by Stephanie Torles. And I just figured, we're talking about feet, like you said, you're still dealing with sick, injured body parts.
Yes.
So there's no better way to take care of yourself than take care of your whole body. So wanted to leave with that.
Yes, and get rid of your bunions, please, Lord. Please, I'm tired of them. They're ugly. All right. Thank you guys so much for taking a break with us today on Mommy Needs a Break. You can definitely take a break with us again next week because we have some lit shows with some great guests, just like Dr. Ebony. Where can they find you and where can they find out more about the show?
Well, you can follow me on Instagram. It's at Dr. Ebony. It's dr.ebony. I also have a website. It's www.drebony.com. You have to spell out the word doctor that time. So doctor in my name, Ebony. But yeah, my website's pretty up to date with everything in terms of, what's happening with the show, new seasons, and what you can expect. So either that website or Instagram, that's where you can find me.
Yay. And of course you can find me, Megan Thomas, at Meg Scoop everywhere. Make sure you join, become a patron, support us. You can find the link in our description. Become a patron and make sure Mommy Needs a Break stays on everybody's TVs and in their podcasts in their cars.
Absolutely.
Yes, and I'm Marisa. Follow me at She Is Marisa J. Make sure to follow Mommy Needs a Break at MNEB Podcast all over the internet, and make sure again to visit our website at mnebpodcast.com, and we will see you next time.
I'll see you on the TV because I'm going to be on My Feet Are Killing Me. My feet are killing me 10:30, 9:30 Central every Thursday.
Every Thursday.